Hey, welcome to episode 7 of Anatomy of a Startup. We've been focused on Mila Health for quite some time. We started with the founder, going through all the things that a founder goes through to get their product ready to go to market. It is in the market. And so I wanted to bring an unbiased, somewhat unbiased third-party opinion of one of the customers. So Christopher Shirley, you're the COO of RevenueWell. Welcome to Anatomy of a Startup.
Thanks so much, Ed. I will say I'm a little biased because I am a customer and we chose Mila, so a little biased there.
Yeah.
But yes, a little bit about me. So I've got a mix of big company and small company experiences. I grew up at General Electric Company, but for the last decade, I've been doing more entrepreneurial things, helping small to mid-sized companies scale, particularly in the digital health space.
Awesome. Yeah, you have a tremendous background. I'm going to drop it in the show notes so people can look you up. Tell us a little bit about RevenueWell.
Yeah, so RevenueWell is a patient acquisition and patient engagement platform. We're primarily in the dental space. However, we do have customers in the dermatology and med spa space.
Awesome. So let's get into Mila Health for a second. So you obviously were looking for something. What was the sort of problem statement, if you will, and how did you find Mila Health?
Sure. So I guess late last year, our company spent a lot of time with dental practices. And one of the major challenges that they're facing are staffing issues, staffing shortages, the ability to keep staff trained. And this is, across the practice. But in particular, they have challenges with front office staff, back office staff, clinical assistants. And so we had identified a problem that we could address with AI agents. And that is really what led us to Mila Health earlier this year.
Very cool. We actually, I think in episode 5, maybe 4, went through an actual demo. It was super, super impressive. I can see why you all decided to leverage it. How does it help the customers? What about from a customer point of view?
Yeah, so from a customer point of view, we are not live yet. We are going to be going live very soon, but it's anticipated to really save the practices a tremendous amount of time. Our first use case is all geared around scheduling and collecting missing patient information. So you can imagine a patient's calling in trying to get in touch with a dental staff member. They may be with someone at the front desk, and so our agent will be able to take over at that point and schedule that patient for a dental appointment. That's really the first use case we're coming out with.
Yeah, and I think from the patient, customer point of view, I know recently I was working with some and I appreciated what they were trying to do, but it was so cumbersome. It was an AI agent, it was all text-based, and it was so cumbersome. I just stopped using it, picked up the phone and tried to get to talk to someone. And that's what I love about Mila Health and the demo that we had showed previously, where it's a very natural conversation. You don't
It
feel like
is.
yeah, you're dealing with an emotional text, but it's really quite empathetic. So that's what I like. What is it like working with the founder, Mila Health? Is it they're easy to work with, hard? How do you think about them?
Well, look, they are great to work with. And one of the big reasons we chose Mila is because of the founder's background. They built the machine learning services for Amazon Web Services, and they were also the team that ran the R&D function at United Health Group. So they know how to build very large, global, scalable systems. Plus, they're healthcare experts. And so that's what really gave us the confidence to move forward with Mila.
Yeah, makes total sense. Christopher, thank you so much for being our guest. This is super helpful because while it's always great to talk to the founders and things like that, it's even better talking to a customer and just sort of corroborating everything that we've talked through in the previous 6 episodes. So thank you so much for being our guest.